Hi, I'm Alex, an ICU trauma nurse here to help you navigate your healthcare and the healthcare of your loved ones. This video today is intended for my RN companions in the hospital. Today we're going to talk about what your job is and isn't before any surgery or procedure. All right, so let's get going. The first thing you want to make sure when you know that your patient is going into the procedures, you want to make sure consents are signed, and if they're not, that the physician comes and talks to them, and that consents are signed for any blood products or the refusal of blood products. You also want to make sure that this patient is a full code, and if they're not a full code, that DNR is in the patient's chart. This is huge. This is missed by a lot of nurses. So full code or DNR. You also want to make sure that their type-in screen has been taken and their blood type is in the computer. Type-in screens are only good for about 3 days. So if they had one last week, they need a new one ordered immediately. Make sure that all vital signs are taken and documented. Remove all jewelry, dentures, document what you have removed and who you have given it to. If they have a family member at the bedside, give it to the family member. If they don't, make sure that you submit that to security, okay? If the patient has any questions, if their family has any questions before the procedure, you make sure that you go get the physician to answer these questions before they go in, okay? And before they sign any consents, make sure that the patient's armband is on. Sometimes this is such a simple thing, but nurses, we miss this because we have so much to worry about. Make sure that the armband is on with the right name, proper date of birth, and that they have any armbands for allergies or special needs for this patient, like if you can't use a certain arm or limb, okay? And last is make sure that you call the patient if they don't have the patient's family, if they don't have someone at the bedside, and let them know that they have left for the procedure, and also document the time that they left off the floor for their procedure. So what is not your job is not to ask the patient to sign any consents before the physician has spoken to them. The physician has to come, explain the procedure, and make sure that they understand before those consents are signed. If they haven't done that, doctors can tell you whatever they want, but they need to come and speak to that patient. Consents are not to be signed till physicians speak to them. It is not your job to explain anything to this patient about the procedure. It is also not your job to translate for physicians. There are lines that the physician can call to translate for the patients. Nurses, we always want to help, but we have so much going on. Make sure that you don't get sucked into translating for the physicians. This is not our job. It's also not your job to answer any surgical questions for the patient or the family. The physician, the surgeon needs to do this. And it's not your job to convince anyone to get any procedure whatsoever or surgery, or to make any promises that things are going to be okay. Many times these patients and their family members come to us with a fear-based disposition, and it is not our job to promise them anything. We can help them have a positive outlook and just really focus on the positive things coming out of the surgery. But it's always important that they understand the risks, and that is the physician's job to do. If you found this video helpful, please like and subscribe. And if you have any questions, you could reach me at alexyourrn@gmail.com. Good luck. You got this, and have a great day.